COVID cases are on the upswing, especially in states with low vaccination rates. And alarming new findings from an internal CDC document say the Delta variant is as contagious as the chickenpox and may cause more severe illness than other strains. Evidence shows that those who are fully vaccinated can still spread the virus, but vaccines are still effective in preventing severe cases. And according to the CDC, it's crucial to acknowledge that, quote, the war has changed. Earlier this week, they reversed mask guidance and now ask that even the vaccinated wear masks indoors in places with high transmission rates. Joining me now, MSNBC medical contributor Dr. Vin Gupta. He's also a critical care pulmonologist and faculty member for the Institute for Health Metrics and Evaluation at the University of Washington. Dr. Gupta, thank you very much for being here. Just from everything that you've read so far, just your interpretation, your perspective of this new CDC finding.
Good morning, Jonathan. Thanks for having me. There certainly is greater urgency to the unvaccinated. And if 2020, Jonathan, was the year in which grandma and grandpa were most likely to see somebody like me in intensive care, 2021 is proving to be the year that any adult 18 years of age and up is vulnerable. And so that threat perception, I think, was brought into stark relief with these findings this week from the CDC. And yet, I'll say, just having been a part of education efforts at on-site clinics across the country, that people are confused by this to some degree. And we need to still provide context that of the 25 states that the Kaiser Family Foundation said are following what's happening with vaccine breakthrough cases, both asymptomatic and symptomatic, Jonathan, that it looks like only less than 1% of total cases are vaccine breakthrough cases, that 95% plus of individuals in hospital ICUs across the country are unvaccinated. So I think that context is still going to be really vital, because when people turn on the news, there's a lot of anxiety and there's a lot of confusion.
I just need to play for you, and I hesitate to do this because he's so loathsome, but it's imperative that what he says be rebutted. Let's just listen to Senator Cruz from Thursday.
The CDC's ruling this week is not accompanied by any data. They did not roll out studies. They did not roll out facts. They did not say suddenly vaccines aren't working. Instead, they just said, trust us. We have double super secret studies that we're not going to tell you based on double secret super data that we're not going to show you. But trust us because we behave like political hacks and obey us anyway.
Now, of course, he said that on Thursday, which was the day before the CDC released its data. But your reaction to what he said?
You know, I don't really listen to Senator Cruz for much of anything in addition to health advice. But I would say that if you want to take what he said and try to find the silver lining here of what might actually be actionable, Jonathan, there is some truth to the notion. There was many of us in public health who were scratching our heads on Tuesday when the CDC put out this new guidance, and yet we were left wondering, well, is vaccine breakthrough disease, is this a serious thing? How frequent is it? How worried should we be about its increased lethality from the Delta variant? Without context, without that data, I do think that did cause some degree of confusion. The way that Senator Cruz phrased it obviously is not helpful to anybody, but I will say, and this is the piece of clarity that I really appreciated from President Biden in his press conference a few days ago, that he was pretty darn clear about what success looks like. He very clearly said it's low hospitalization rates, high rates of vaccines at the county level. That's why he said, Jonathan, he went unmasked in places like Philadelphia and Delaware, whereas otherwise the CDC data and their risk matrix would have argued for him to put on a mask. He said he didn't because he was in places that didn't have COVID-related stress. The fact that the president even wasn't able to articulate what his own CDC put out, to me, that's the tension here. That's the confusion. But if we work past that, we do have clarity on where we're headed. We're headed towards COVID being endemic.
Dr. Gupta, so there's video that I think we're going to show as I'm asking you this question. In Chicago on Thursday, Lollapalooza, you had just hundreds maybe thousands of people you see there celebrating in public. Tomorrow is August 1st. August being family reunions and barbecues and people getting together. What do the CDC data say to you, given the CDC data? What do you say to folks in Chicago for Lollapalooza, folks heading to family barbecues and reunions? What should they do now that we know this data from the CDC?
This is what I would say to everybody, that it's urgent to get vaccinated, ideally with a 2-dose regimen, Pfizer or Moderna. We just know the most about it. Those 2 regimens, Jonathan, vis-a-vis the Delta variant, and they're extraordinarily effective. That's a key part of the CDC data set that was released on Thursday that we're not talking enough about. That still the vaccines are 95 to 100% effective against going to the hospital, even 88% effective against symptomatic illness. So the vital importance of getting vaccinated, ideally with 2 doses of Pfizer or Moderna, and that if you live in a place where you're hearing hospitals are packed or brimming up. I was just down in Clark County where their ICUs are filling up. Their test rates for COVID are filling up, that you should also mask up, regardless of your medical conditions, regardless of if you've been fully vaccinated, because then the chance you could get exposed in the community is higher. But if you're like President Biden in Philadelphia, where hospital rates are low, test rates are low, vaccine rates are high, get vaccinated, live your life.
Dr. Vin Gupta, thank you very much for coming to the Saturday Show.